the associate degree is the highest level of degree for a surgical technologist. If you would want to go into teaching or more into management within the operating room, we do recommend students go on for a bachelor's degree. Starting pay is anywhere from $20 to $24 an hour. Our students are required to take a certification exam. All students are prior to graduation. We have had a 100% pass rate the last 3 years. Good candidate is someone who is a quick thinker, because there are times that you have to think on your feet and just make a change. Critical thinker as well, that you can take what you learned in previous cases and apply it. You have to be a good communicator, a great team player, and someone that can withhold their emotions, because sometimes it's a stressful job and things can quickly change, and you have to be able to go with that flow for that patient's safety. Students who also tend to be successful in surgical technology have a deep interest in biology. Biology is one of your big things. So if you have the opportunity to take an anatomy class when you're in high school, that does help you. I also highly recommend chemistry, because we are working with different solutions and chemicals within our program, and we also realize how our body works using chemistry. We are a 2-year Associates of Applied Science degree. However, there are some general education requirements like advanced anatomy and physiology that would have to be taken prior to entrance. So it technically is a 2.5-year degree program. So in the first 8 weeks, you learn the ideas and the theory behind why we do what we do. And then we start actually learning all the skills. So we start very simple with how to clean an operating room, to opening supplies, to then applying those principles of sterile technique with scrubbing, gowning, and gloving, and setting up surgical procedures. You are making sure that everything is sterile for your patients that are coming in, and you are assisting your doctors. We are learning instrument names, equipment names, and you learn how to set up for different surgical procedures. Also how to work under pressure. We work in surgery. We are not ones that, are out and about on the floors. We do have 2 full labs that are mock ORs, and the ability to create a 3rd one within the classroom. There are many opportunities for students with this career. There's obviously a hospital or a freestanding surgical center, which in our area we are getting more and more of. And then also students will have the opportunity to work directly in a doctor's office. If they wanted to work with a surgeon, that they would be the surgeon's personal scrub. They can also work in a sterile processing department where all of our instruments are sterilized. There's also opportunities to work in a veterinary clinic, a dentist clinic, and medical sales rep. We are a great program to come to.